Responsive feeding therapy, nurturing healthy eating habits in children. In the intricate dance of parenting, one of the most crucial steps is feeding your child. It is not just about filling their bellies, but about fostering a healthy relationship with food that can last a lifetime. Responsive feeding therapy emerges as a guiding philosophy in this delicate process, emphasizing the importance of understanding and responding to a child's cues and needs during feeding times. Understanding responsive feeding therapy. Responsive feeding therapy is a child-centered approach to feeding that prioritizes the child's cues, preferences, and developmental stage. It stands in contrast to traditional feeding practices that may be more focused on external factors like the clock or the amount of food consumed. At its core, responsive feeding therapy is about trust and communication between caregiver and child. It recognizes that children are born with innate hunger and fullness cues and aims to preserve and respect these cues rather than override them with external pressures. Key principles of responsive feeding therapy. Recognizing hunger and fullness cues. Responsive feeding therapy encourages caregivers to tune into their child's hunger and fullness signals. This involves observing subtle cues such as lip smacking, rooting, or turning away from food, and respecting them as indicators of when to offer or withhold food, encouraging self-regulation. Instead of coaxing or coercing a child to eat a certain amount of food, responsive feeding therapy empowers children to self-regulate their food intake based on their individual needs. By allowing children to decide how much to eat, caregivers support the development of healthy eating habits and prevent overeating or undereating. Creating a positive mealtime environment. Mealtime should be a relaxed and enjoyable experience for both caregiver and child. Responsive feeding therapy emphasizes the importance of pleasant mealtime interactions, free from pressure, coercion, or distractions. This can involve sitting down together as a family, offering a variety of nutritious foods, and modeling healthy eating behaviors. Respecting food preferences and choices. Children naturally have preferences when it comes to food, and responsive feeding therapy respects and accommodates these preferences whenever possible. Caregivers can involve children in meal planning and preparation, offer choices within healthy options, and be patient as children explore new foods at their own pace. Understanding developmental readiness. Responsive feeding therapy recognizes that children develop at their own pace, and feeding practices should be tailored to each child's stage of development. This means being patient as infants transition to solid foods, respecting toddlers' growing independence and autonomy, and providing age-appropriate opportunities for learning and exploration. Benefits of responsive feeding therapy. The benefits of responsive feeding therapy extend far beyond the dinner table. By fostering a positive feeding relationship and supporting children's innate self-regulation abilities, responsive feeding therapy can promote healthy eating habits and preferences, prevent feeding problems and selective eating behaviors, support optimal growth and development, enhance caregiver-child bonding and communication, lay the foundation for a positive relationship between food and body image. Responsive feeding therapy offers a compassionate and evidence-based approach to feeding children, grounded in respect, trust, and understanding. By prioritizing the child's cues, preferences, and developmental stage, caregivers can nurture healthy eating habits that last a lifetime. As we navigate the complex terrain of parenting, responsive feeding therapy serves as a guiding light, illuminating the path toward raising happy, healthy eaters.